knee. We haven't really talked about this yet, but if your knee is bent, you can rotate your knee. I can move this here. If you feel the front of your knee, you can feel the tibial condyles moving back and forth. Okay? You can't do it when the knee is extended. But if this biceps femoris pulls, which way do you think the tibia is going to rotate? Out this way or in this way? Out. So the biceps femoris, if it acts by itself, is going to laterally rotate the tibia with the knee flexed. And then when we talk about the ones on the medial side, the semitendinosus, semimembranosus, those are going to internally rotate. Okay?
Did everyone sign
Did
in?
everybody sign?
Yes.
Ooh. Guess this one's working. Sort of. You blink, you miss. So that's going to show the long head. And then here's going to be the short head on that linea astra. And then they're both going to insert. And so I guess here's where the two heads are coming together, and they're all going to merge on that lateral side. So they sort of come together in the middle of the thigh. So now we have semitendinosus and semimembranosus. So if you're drawing that on your little diagram there, it's coming from the ischial tuberosity, just like a lot of the other ones. And then it comes down across all the way down here to this pes insurine area, which again is on the medial part of the proximal tibia. All right, so again, it crosses two joints. So it's going to do what at the hip? It's going to extend the hip. It's going to flex the knee. And with the knee bent, it's going to immediately rotate the knee. So semitendinosus, semimembranosus are basically going to have the same action. A little bit different because the tendinosus goes to this pes insurine area. This is going to be tendinosus and membranosus on this side, and that's going to be the biceps femoris on that side. Because when you feel in the back of your knee, basically you feel these two groups of tendons. One main one on the lateral side, that's going to be biceps femoris. Right? And then on the medial side, you're going to have a few of them there. And we'll talk about how to differentiate those in a few minutes. So here's semimembranosus. It's coming from the ischial tuberosity, but it's going to be higher up on the back side of the tibial condyle. So here's this pes insurine coming down here. So that tendinosus goes all the way down here. So that's this part here. Whereas membranosus just goes farther up on the tibial condyle. So this muscle, the reason why I call it semimembranosus, if you actually look at the muscle three-dimensionally, it's more like thin, like a membranous type of a muscle. It's like a thin sheet, whereas semitendinosus comes into and forms a thick tendon down at the bottom where you can feel this tendon. Okay? And then we'll come around and do palpation because you can feel the difference between which tendon is which in the hamstrings. Okay, so just remember, the semitendinosus is the one that comes all the way down here to that pes insurine area, and it comes with the gracilis. Okay? So that's like the what, Captain Morgan. I knew you were thinking it.
But you drink, don't put the hat on.
Let's see it.
Get a little captain in there.
So again, it's going to immediately rotate the knee if the knee's bent. Okay. So the membranosus goes into the medial condyle of the tibia. So it's farther up the knee, farther up on the tibia. So it's going to be basically back here. I don't know if you can see that over here. It's going to be back here, whereas the other one comes around towards the front. And you can feel that when you're palpating to tell the difference between the different muscles. Sure. Yeah. So it comes off the ischial tuberosity, right? Then it's going to go down all the way to this pessons rind area here. The membranosus? Right, but it goes farther down. Okay, why don't we do this now so I can show you. If you're, that's why I wore shorts, right? So you can hold this up like that. Okay, so shorts? If you're needling well, they are now when you roll them up. So here's the pessons rind area, right? So if you're resisting here, the gracilis is going to go straight up here. So that's going to be the tendon that's most superficial right here. That one's here. And then semitendinosus is the one that comes here, that goes around this area here. And then membranosus is going to be more on the inside, and it's going to go more straight into here. Okay, so the way that you, let's see. If you come up the side here, the one you're going to feel here is going to be gracilis. If you trace it, if it's going straight up this way, it's going to be gracilis, right? If it's coming around this way, it's going to be sartorius. And if it's down underneath here, it's tendinosus. And then membranosus. So I can go around and show you the different, how to tell the different ones are. So whenever somebody's got a knee exposed, I can show you.
So he's got a good knee there. What the hell, knee?
So this one is going to be gracilis.
So the one on the outside.
Yeah. And then this one's going to be.
You know, he's got better knees than me.
Oh, come on, you just didn't want to drive the one wild.
Well, you know, knees
are
aren't really my best feature, you know?
Okay.
Is the membranosus the thicker one?
You don't feel it as much of a tendon. You're not really going to feel it much. You have to go deep under. You have to go kind of underneath. Everything is today. PGOGOQ. That's what you get.
There you go. See?
You have to run quick.
What's that?
Oh, sorry, I was telling her.
Go,
Somebody
P.
said the thing.
Nice.
Thank you.
You have this muscle right here, shaped like a pear. So it's not called the piriformis, it's called the what? Piriformis. Or you could call it the piriformis if you want.
Which one is it?
This one right here. It's coming from the sacrum. So if you want, if you have those little sheets that you can draw stuff on, you can draw it from the posterior side. Because you know the way that sheet works, on one side is anterior, one side is posterior. And the way you can tell the difference is what side's the kneecap on? Anterior. So if it's got a kneecap, then that's the front. So you want the one that doesn't have the kneecap. So it's coming from the anterolateral surface of the sacrum, and then it goes to the greater trochanter of the femur. Okay, so that's going to be the piriformis. So what's that motion going to do? If it's right here and it comes together, it's going to externally rotate. Right, so remember, external rotation, what happens to the front of the thigh? It goes out. Okay? So piriformis is going to be an external rotation. All these are rotate. All the area here, like in your back pocket, or the gluteal muscles. Okay?